Hello and welcome to Herbal History. This episode will cover the anti-cancer drug Taxus, how it was discovered, the formulations made, and the clinical trials that confirmed its effectiveness. We will start with the origin of this chemical. In August 1962, a 32-year-old botanist named Arthur S. Barclay obtained samples of a Pacific yew plant known by the scientific name Taxus brevifolia under contract to the USDA. The samples were sent to a Maryland laboratory where it was tested to see its effectiveness on different diseases and such. The researchers who tested it found that in a cancer cell culture, growth was inhibited when applying the extract of this bark. This indicated that there exists a chemical or chemicals within this bark that were anti-cancer in nature. This chemical was later found and isolated and named paclitaxel, which we'll call PT from here on out for brevity's sake. The implementation and extraction of this chemical was slow initially due to the complexities involved in synthesizing the chemical from the Pacific yew tree. Later on, a company called Polysciences found that they could make PT from a chemical called 10-decatibaccatin-free. I am definitely butchering the name of this chemical. But despite its long and complicated name, this chemical is found commonly in Taxus baccata, or the common yew, which is a plant grown commonly in many gardens across the world. And so, the ability to mass produce one of the first chemotherapy drugs was well underway. Now onto the formulations of this drug. Since the chemical PT is hydrophobic, it doesn't absorb easily into people. So new formulations with different additives to improve absorption were made. The first attempt was the use of cremphor. This unfortunately added an extra hypertoxic effect to this treatment. So it's later replaced with albumin, a protein commonly found in eggs. This formulation reduced the side effects of PT by a considerable margin, making it more patient-friendly as a result. Later on, a new formulation called Oraxol, an oral PT compound, was made. They found a chemical PGP, which enables the use of oral consumption of the PT chemical, allowing for oral use of chemotherapy. A recent trial was done with 28 patients, and this seemed to show that this oral formulation has less toxic side effects than previous formulations of PT chemotherapy. This would allow people who have had hyperactive reactions to chemotherapy to use chemotherapy drugs to treat their cancer much more efficiently and safely. But there's still side effects, which we'll cover in the next part. Now on to further side effects and trials that happened. There was a phase 3 trial where they tested the oral version of chemotherapy PT on 402 patients with breast cancer, comparing the IV drip version of chemotherapy PT with the oral form. And here are the results. The oral form of chemotherapy was less effective in treating cancer than the IV form, since after the treatment was finished, 35.8% of the tumor still functioned after the first round of PT chemotherapy in the oral form, compared to 23.4% that remained in the IV group. This indicates a reduced effectiveness of the chemotherapy, but there's also a reduced risk of neuropathic damage with the use of oral PT chemotherapy in comparison to the IV form. The risk percentage is 17% to 57% respectively. However, there is also an increase in infection, gastrointestinal damage, and blood damage in the oral form compared to the IV form. although these effects were low grade. That about covers the history of the PT chemotherapy drug and the plant it was derived from. Thank you for watching. See you on the next one.